Module Overview. Healthcare is an arena of competing interests, urgent decisions, and high emotional stakes, where even the most well-intentioned professionals may face complex ethical dilemmas. This module addresses real-world situations where ethical principles such as autonomy, beneficence, non-maleficence, and justice collide with legal responsibilities, public health obligations, and institutional policies. Particularly, it focuses on the ethical and legal challenges surrounding confidentiality breaches. You will explore how to ethically reason through situations where confidentiality is at risk or must be lawfully overridden, such as child protection, domestic violence, infectious disease outbreaks, and mental health crises. 1. What is an ethical dilemma in healthcare? An ethical dilemma occurs when two or more moral principles conflict, making it difficult to determine the right action. Examples: should a doctor keep a teenage patient's abortion confidential from her parents? Should a nurse report a patient with HIV who refuses to tell their sexual partner? Should a physiotherapist disclose suspected abuse if the patient denies it? These dilemmas demand ethical reasoning, legal awareness, and professional judgment. 2. Core ethical principles in healthcare. 1. Principle 2. Definition. Autonomy. Respect for individuals' right to make informed decisions. Beneficence, duty to do good and act in the patient's best interest. Non-maleficence, obligation to avoid causing harm. Justice, fairness and care, rights and resources. Fidelity, faithfulness to professional duties, including confidentiality. When these principles conflict, ethical dilemmas arise. 3. Justified versus unjustified breach of confidentiality. Justified breaches, ethically and legally supported, to prevent serious harm or death, to comply with legal obligations, e.g., reporting child abuse. When patient lacks capacity and disclosure is in their best interest. Public health mandates, e.g., COVID-19 notification, unjustified breaches, ethically unacceptable. Gossiping about patients sharing medical info with friends or family, accessing records without clinical need, posting patient cases online, even anonymously. Professionals must always weigh necessity of disclosure, proportionality of the breach. Alternative approaches, minimum necessary information shared. 4. Case studies of ethical dilemmas. Case A. Suicidal teenager. A 16-year-old girl reveals suicidal ideation but refuses to let the clinician inform her parents. Conflict. Autonomy versus non-maleficence. Ethical action. If risk is immediate, clinician may breach confidentiality to prevent harm, but must explain decision transparently and involve patient when possible. Case B. Undisclosed ST. IA man tells his doctor he has an STI but refuses to inform his partner. Conflict, confidentiality versus preventing harm response. Depending on jurisdiction, the physician may have legal grounds to disclose in order to protect the partner, but should first strongly encourage patient to disclose. Case C. Patient with dementia. A patient with advanced dementia resists a care plan that family and doctors believe is in their best interest. Conflict, autonomy versus beneficence. Resolution, assess legal capacity. If lacking, act in best interest per Mental Capacity Act, UK, or Provincial Guardianship Laws, Canada. 5. Legal frameworks for disclosure without consent / in specific situations, confidentiality can be lawfully breached, safeguarding children or vulnerable adults, court orders or subpoenas, preventing or detecting serious crime, serious risk to health or life of others, communicable disease control reporting, COVID-19, HIV in some jurisdictions. Each action must be documented clearly, discussed with a legal advisor or senior, justified in proportion to the risk. 6. Ethical decision-making models. Use structured frameworks for consistent ethical practice. Four-box method, Johnson et al. Medical indications, beneficence, non-maleficence. Patient preferences, autonomy. Quality of life, overall well-being. Contextual features, justice, legal, institutional, family. Beauchamp and Childress approach balance principles and assess which carries more ethical weight in the given context. 7. Role of ethics committees and consultations. When unsure, seek guidance from hospital ethics committees. Consult with legal advisors or data protection officers. Discuss with senior colleagues or multidisciplinary teams. Ethics consultations provide diverse perspectives, reduce moral distress, support institutional integrity. 8. Accreditation and professional codes. Healthcare providers must uphold GMC/NMC ethical standards, meet GDPR and Data Protection Act 2018 compliance, align with institutional policies on safeguarding and risk management audit criteria, include proper documentation of ethical decisions, evidence of staff training on breach protocols, incident reporting and root cause analysis,